Good afternoon, ladies and gentlemen, and thank you for tuning in for those who are watching at home. The purpose of today's briefing is to address the large spike in the number of COVID-19 cases over the past week and to give the community the most current assessment of our situation in Victoria. In the past 3 days, we've had 89 newly confirmed cases of COVID-19. We're seeing increasingly widespread community transmission of the virus. As of yesterday, we had 150 active cases in Victoria County, and that number will likely increase further. The approach we're taking with this public health issue is to serve as a resource for direction and information and guidance rather than by issuing orders or mandates or threatening residents and businesses with fines like you're seeing in some other jurisdictions. This is a public health issue primarily and not a law enforcement issue. And I believe to the extent possible, it should be focused on as a public health issue. We're asking the community for cooperation as we work together through this. Dr. McNeill and David Gonzales will address in detail the public health specifics and actions that can be taken here momentarily. But I wanted to speak to some of the specific trends we've seen in the recent cases over the past few days. The increased levels of testing contribute to, but certainly don't paint the full picture or tell the full story of why we're seeing so many new cases. The new cases we're seeing are primarily due to the number of social gatherings that are now taking place. For months, those were largely curtailed and limited, but they have largely resumed, and that predictably is leading to a lot of increased spread. Some other trends that we're seeing, talking to our epidemiologists, is that within family units there's been a lot of spread where one infected individual spreads it to the entire family. And then also something else that has been identified in the research in some of these positive cases is the very unfortunate and frustrating occurrence of sick individuals, COVID symptomatic individuals who don't want to be tested because they don't want to be isolated for any period of time. They don't want to have the stigma of having COVID, so they go to work, go out and about, infect other people. And that's truly an unfortunate event because I think we can all agree that those with symptoms, those who are sick, ought not be exposing the virus to other people. The fact of the matter is that testing positive for COVID-19 shouldn't have any stigma related to it. If you test positive for COVID, that doesn't mean you've been irresponsible. If you test positive for COVID, that doesn't mean you've been careless or reckless. What it does mean is that you ought not be around other people exposing them to the virus. Absolutely anybody can get COVID, even if you're super careful, it can still happen. And if you have symptoms, you ought to get tested and isolate yourself until you get those test results. There's ample availability of testing in Victoria. On Thursday and Friday, we've publicized the fact that there will be available out at the community center in the parking lot, a walk-up, no appointment necessary, no cost, no doctor's note required testing that'll be done. That's going to be from 8 to 4 on Thursday and then 8 to noon on Friday out at the community center parking lot. Again, no cost, no appointment, no doctor's note needed. So certainly anybody who is symptomatic on those days ought to get tested. But even aside from that, we have ample availability in Victoria, ample tests to be conducted. A couple precautions that we're taking from the standpoint of the county. And it is unfortunate because it's always a good time out there every year, but Patriot Park on July 4th, which generally accommodates a lot of folks out there shooting fireworks, that at the decision of Commissioner's Court and our fire marshal, we've opted to not have that open on July 4th to limit those big groups of people that are always out there. Secondly, our Commissioner's Court meetings, we continue to have those available via Zoom for anybody who wants to participate and listen in but would prefer not to be there in person. And then also we, at our county facilities, are asking what we will be asking our business owners to do, and that's to wear masks going forward. For those coming into our county buildings, we'll be offering a mask for those who don't have them in an effort to keep everybody as safe as possible. While we are approaching this from a public health standpoint and not doing any mandates or orders, I will point out that, and it's been publicized, TABC, the Texas Alcoholic Beverage Commission, is taking a much more active approach to enforcement of occupancy violations. Local establishments were visited over the weekend, and going forward, it's clear that TABC is going to be taking a more active approach than it has previously, which is a good thing to make sure occupancy rules from the state are adhered to. So those are a few notes there. I'll turn it over to Mayor McCoy at this point.
Thank you, Judge. One thing that we have done today, the judge and I a few moments ago did sign disaster declarations for both the county and the city. And the reason for that primarily is this is a serious situation. This is a serious health care emergency. And we want people to take it seriously. At this moment, it's not our intention to write mandatory orders. What our intention is to go back to what we did before, and what the governor basically said in his remarks yesterday. There's a very detailed manual in here that gives recommendations for opening up Texas. And we, before even this was done, our command units here, our law enforcement agencies, I think at one time had visited over 600 businesses to help them understand the orders that the judge and I put out a long time ago, which basically are in many ways similar to what the state has come to. So our intent is to do the same thing with this declaration of an emergency. We've got our command staff working up the logistics of doing this right now, of how we can go out and help businesses. When this first happened, we helped businesses when they opened at 25%. Our fire department, who controls occupancies inside the city, went to these businesses, helped them determine how many tables they needed and the proper protocols in doing it. Another thing that the governor made very clear yesterday was he strongly suggested the voluntary use of masks, and they made it very clear that these masks are to keep you from spreading a disease. Don't get the false impression that wearing the mask protects you. It's to do the best we can to keep you, and especially those who are asymptomatic and able to spread the disease, from doing so. As the judge alluded, many of the cases come from large gatherings that are really outside of our businesses, and they've created a lot of young, primarily people who have contracted it, and them unto themselves, as long as they stay amongst themselves or hopefully self-isolating, it's not a problem. But when they choose to go into a business, knowing that they can spread the disease, that is a reason that businesses need to think about what their policies are. And to that end, we have reached out, the judge and I have reached out to our Chamber of Commerce, and we're going to have a meeting tomorrow afternoon with the executive committee of the Chamber, and we're going to invite David Gonzales and Dr. McNeill to that meeting as well to have a dialogue with that group about what we're facing and the dangers involved and what could be done about it. And we hope that they would adopt policies of their own that they can share with their members to heighten the awareness of what we can do, the few things we can do to hopefully stop or minimize the spread of this disease. We can't stop it 100%, but we've got to at least make the attempt. I think for me personally, I watch those numbers of how many positive tests we get per testing, and I think when I was told we're a little bit above what the state goals are, but less than what the state is seeing. And that's encouraging. But what we've got to really be cognizant of is availability of our hospital and ICU beds and things like that. And that is a subject that I think will be spoken to later by Dr. McNeill. But we've got to take this seriously because it is serious. And I come to it in a different perspective. I am one of those people that are at risk. And I hear people telling me that you should just go home and stay there to protect yourself. Well, but I don't think it's right that irresponsible people who choose to be irresponsible, in essence, sentence me to house arrest. They need to be responsible enough to understand that even though they may not have serious implications from this disease, they can give it to someone who will. And that's why I think we need to talk more about, instead of me, we need to start talking more about we. And the last thing I will say is the city is taking steps to have a fireworks display on the 4th. It's going to be done primarily in have you arrive in automobiles and set up to be as safe as possible for people. And that's still underway, and that's what we hope to do to provide an alternative for people on the 4th to celebrate this wonderful country. And the last thing I'd like to say is serious matters require mature and reasoned response, and that's what the judge and I are trying to do. Thank you.
We're happy to answer any questions. Yes, ma'am.
Is it possible legally to mandate wearing masks in public at all times?
After much debate over the past several days, I think the consensus that most have arrived at is that it is legal for judges and mayors to require businesses to require their customers and employees to wear masks. Unnecessarily complicated, probably, but that's as the orders are written from the governor. Our ability is to require businesses rather than directly requiring individuals to do anything. Of course, at this point, as I mentioned, we aren't issuing any mandates or orders. We're serving as a resource for guidance and direction.
The second part to that is that I've had business owners ask me to ask you, can business owners then mandate that their customers upon entry must be wearing masks?
That's
Absolutely.
Right.
Absolutely, and that's encouraged. In the same way, no shoes, no shirt, no service, you can add a mask to that list as well, certainly.
And I might add that is precisely what our early orders suggested way back when. We reminded businesses that they have every right to request that their patrons wear masks.
Kara, you had something.
Judge Mayer, I'm sorry, I'm not clear. Is there anything different you're really announcing today, or you're just continuing to encourage folks to wear masks?
We are certainly making these recommendations and encouragement. One thing that is new today is the 7-day disaster declaration as we watch things unfold over the next week. As the mayor mentioned, that declaration doesn't have any mandates or orders tied to it. It does certainly enable us to do anything we deem appropriate over the next week, but at this point, as I mentioned, we're consciously taking the approach of guidance and recommendation and direction rather than threatening business owners with a $1,000 fine like you're seeing in some other jurisdictions. Go ahead, Mayor.
I can tell you one thing. If you listen to the governor yesterday, his idea is still voluntary. But his comment was the last thing we want to do is shut down Texas again. But he did not take it off the table. So.
And one thing important to remember as well is that the array of options available to us previously have been removed. In this COVID-19 battle, local officials, the discretion of local officials has been removed in most respects through executive orders from the governor. We do have the ability to make that mandate for businesses, but we're not doing that at this point.
Would that be something you'd consider if the infection rates continue to grow?
We will see. We will see. Well, the one thing that I would hate to see happen, and I think it's already happening to some extent, some small businesses that only have a few employees, once their employees get sick, their businesses are shut down. So the last thing I want to see is the virus shutting us down when we can take measures that would help slow it down or prevent it. So whether we slow it down or not, if people don't take the measures themselves, their business is going to shut down because their employees are going to all have it.
We can take one more question before David and John come out. Yes, Ingrid.
So my question is about business occupancy loads. Where are those primarily located for customers to come in and see so that they can themselves be more informed? And then on the business end, where does your occupancy load, or occupancy capacity rather, need to be displayed? And what percentage are we at now for businesses?
Where should that be displayed? That'd be a city code question.
Some businesses posted or not. I know when the opening first began that our fire department, who typically monitors occupancy in buildings, so, every space has technically an occupancy. They were very active in going out with business and discussing what their occupancies were. And I think they even printed a chart at one time about different things. So I would go back to them and let them provide that information, because I believe they were providing it to businesses to begin with. Okay.
Very good. Thank you all.
Thank you.
We'll let Dr. McNeill and David Gonzales step out here once we leave the room. Thank you all.
I keep waiting for someone to introduce us. Good afternoon, Dr. John McNeill, Local Health Authority for the Health Department. I've got just a few things. They've given me a list of the most common questions that people have been asking, so I'll go through that stuff and we'll talk about those things and look at that. David will give us a bunch of the numbers and tell us some of the more intellectual facts, and then we'll be around if you have any questions, okay? So let me tell you that, of course, we're all here, and you know why we're here, because there's been a spike in the cases. I mean, an unbelievable spike. I mean, well, actually not unbelievable, but we've had a significant increase in numbers, and this, without any doubt, is directly correlated to what's going on in the community. We're having a lot less. We're having a lot more people in crowds. We're having a lot of people that are together that are not practicing social distancing and not wearing masks. So it's understandable. I mean, I'm not blaming anybody. I'm just stating a fact, and that's what happens. And so we know that. We knew that was going to happen, and we said it was going to happen, and that's just what it is. So what we need to do is we need to do everything we can to try and stem that. So we'll give you some more information today and tell you some of the things that we're thinking about. And the judge and the mayor have told you some of that stuff too. We do have 38 cases yesterday. I'm sure y'all are familiar with that. Yesterday we were up to 150 active cases. I can tell you that one of the things that we really watch is the number of patients that are hospitalized. And as of last week, hospitalizations in Texas have gone up about 85%. So that is something that we watch and something that we're concerned about. So we keep watching these numbers. I can tell you that right now, DTAR Hospital has approximately 10 COVID patients. Citizens has 11, including 2 that are in the intensive care unit. So we do have some sick people. And remember, they don't get in the hospital until they get sick, and this is typically toward the later phases of the disease. I mean, people typically don't start off very sick and end up in the hospital with COVID. It can happen, and I have seen it happen. But for the most part, it's a disease that lasts a few days, of course, and patients just get worse and worse, and typically they get short of breath, they develop pneumonias, and they end up in the hospital. 20% of them end up in the intensive care unit. So we know these numbers because we've seen them in other places. So the thing that concerns me, or one of the things that concerns me now, is that we're in the early phase of a rapidly expanding acute outbreak. So I don't know how to say this nicely, but I don't think that there are enough people that have been sick long enough to really end up in the hospital yet. So we're watching those numbers closely. A surge in our hospitals is one of the things that we fear the most as far as being healthcare providers and being people that take care of patients with COVID. We are at widespread community transmission, and I told you in the very beginning that that's the thing that we didn't want to be at, and that's when we would start worrying, and that's when that things would get, for lack of a better term, nasty. So we're seeing a lot of this stuff going now. We are seeing widespread transmission, and I will tell you something that one of the that an epidemiologist, well, it was Brittany. She's real smart. So she and I have talked about this, and one of the things she told me was that, and I agree 100%, that right now, folks, I can tell you, if you go out into a crowd of people and you're with a bunch of people that you don't know, and you're with a bunch of people that have been with a bunch of people they don't know, and you don't have a mask on and you're not social distance, you can pretty much just consider yourself exposed to COVID. It's that rampant. It's that widespread right now. It's really all over. So, and we're seeing it every day. We see the cases of the people that get sick, but there's a lot more who get sick and have mild illness. They can still transmit the disease, though, but sometimes they don't even seek care. We've seen patients that have had COVID that sometimes they've been sick for the last week or two and they don't have very many symptoms. I've seen patients that end up in the intensive care unit and don't survive, and I've seen patients that have had the disease that only have fatigue and maybe a mild sore throat. So it's completely variable and it's hard to know. But the dangerous thing about this virus, and I've said it since the get-go, is that this disease is transmitted many times before you even know you're sick. So the people that you're around may have already been sick, and they just decided they felt well and went out to the bar or went out to wherever they went into their social group or went to their family's house for a get-together. But whatever it is, the virus is out there, and you need to take care of yourself. You need to take care of the ones that you love. Okay? So how are the hospitals looking? I can tell you this, as far as personal protective equipment, we're actually okay. I've spoken to the people at the hospital. We do have personal protective equipment available. That was a big problem in the initial, especially on the East Coast, especially in New York and the bigger cities, where they didn't have enough personal protective equipment. We're okay from that standpoint. Our surge capacity, we're still able to do it. I can tell you right now that at Citizens Medical Center, I can't give you the numbers for DTAR, but I can tell you that we have about 6 or 7 ICU beds available. So that's not a whole lot. We could fill that up overnight. So we do need to be careful about this. One of the things I will also tell you that as I work in the emergency department, if we have patients that have to be transferred to another facility, it is getting very hard to transfer those patients. Why? Because the bigger cities' hospitals' ICUs are full. So we call hospitals and say, hey, I have a patient, whether it's related to COVID or not, and I say I need to transfer this patient. I can't do it sometimes because they have no ICU beds available, or they have no specific beds available for that type of patient. So that is making it harder. So that within itself is interfering with our ability to take care of some patients that need to go to tertiary care centers. We send a lot of patients to Houston, and right now it's hard to get a patient into Houston because they're full themselves. So that's something else that goes on with this deal. Where are these cases coming from? That was one of the questions. It'd be easy for me to say that, and we know these numbers. I mean, we look at this stuff, and the epidemiology team does wonderful contact tracing, and we find common denominators in these patients. and we find common denominators. And, I could tell you that there are certain bars that there have been a lot of cases from, and there are certain areas and there are certain family get-togethers. But that's really, when you get down to the bottom line of it, that's really not the point. The point is that someone went there and made a decision to not social distance and not wear a mask. That's all it boils down to. This is a personal decision. So blaming it on a business or blaming it on a facility like PAM or Citizens Medical Center, and we'll talk about that in a minute, but that's not really the issue. The issue is that people went somewhere and got exposed. So just be careful. That's what it's all about. Just be careful. So let me talk right now, and I'll mention some things. I have been in contact with the people, with the administration, and with the chief medical officer at Citizens Medical Center, and we all know now that they have an outbreak. So I can tell you that I just got off the phone with them. I'm very well familiar with this because they've been very transparent. They literally contacted myself and the health department within 1 hour of the first case that was positive in their hospital. And we watched this thing progress the entire time. I will tell you they've been completely cooperative. They have done everything that they need to do. In fact, they've done it they did do it before they even contacted us. So every patient or every employee there that's been positive, and I'm told that there were 19 employees that were positive. They're up to 19 employees that were positive. All those patients have been identified, or they've been tested, identified, and they've been isolated. They've been sent home. Of course, a terminal clean of every department that they were in or any person that they came in contact with. All the cleaning was done. Every person that has been in contact with any of those employees that was positive has been tested and has either gotten their test results back or they're pending and they will be back today. So all these that are suspected have been isolated as well. So I can tell you that pretty much right now, we think that outbreak is contained. Okay, it's being monitored very closely, though. I will tell you that there has been no evidence of any transmission to patients. Okay, and you say, well, how can you know that? Well, because we test them. Okay, and we watch them. Of course, they're in the hospital. We know if they've been sent home, they're sent home with instructions to be watched, and they're tested before they leave. So we have a great idea that this has not happened, and that's very believable because you have to understand that in the hospital, healthcare workers wear N95 masks. They wear good masks. Most of them that I work with, and myself included, sometimes we wear 2 masks. I mean, I wear an N95 mask with one of these over the outside of it, so I can keep my N95 clean if I go in with someone that I know is COVID positive. So we do these things, and we're very careful about this. So when we're exposed to patients, ironically, I can tell you, and we've looked at it, and I'll just tell you a little something that we found, is that most of these cases were transmitted between each other in nursing areas or in areas where there weren't patient care, and maybe someone took off a mask, or they went to a place that all go to a break room and they eat together and things like this. But once again, what's the common denominator in that transmission? No mask and people around each other. So it happened. But I'm telling you that this has been well managed and well taken care of. Like I said, all the contacts with potential exposure have been contacted. I will say this, if you were at the hospital or you were a patient at the hospital, if you have not been contacted, then that means that you were deemed not a significant risk, okay? Everybody is being watched very closely. The risk of transmission from staff to patients is exceptionally low. And incidentally, also, we look at this and no specific source has been identified. So it's not like we found one person that was there that we think came in with COVID and was missed or anything like that. So as far as other things, and I'll certainly answer any questions about Citizens if you have that, but needless to say, they have they've been very cooperative and done a good job in containing this outbreak. So as far as recommendations for sporting events, fundraisers, and social gatherings, this is real simple. This is real simple. Don't go in a crowd of people and get close to them if you don't know who they are. Even if you do know who they are, don't go in a crowd of people. I mean, we see it all the time. People go for a big family get-together, I mean, there's been occasions I wanted to have family get-togethers, but we don't do it. We don't do it because all it takes is one person. We hear it all the time. I mean, they have 20, 30 people over for a barbecue. Well, one person was exposed to someone 3 or 4 days before. They're not showing symptoms, but they're COVID positive, and we get 5 or 6 people from that one event that are positive. Well, those 5 or 6 go home and they give it to their families, and then they don't know it, then they give it to someone else. And then we end up with 38 cases on one day, and no telling how many today. There's a bunch cooking right now. I can tell you there'll be more, and there'll be more tomorrow. So we've got to stem this. We don't have specific medications we can give. Some of the medications we talked about have not really panned out, so to speak. We do have some medications we can treat you if you're critically ill. So we need to stress the spread of this being a respiratory droplet spread disease, okay? Now, anybody out there that's doing the little blog thing or whatever it is that shows up on our feedback there, if y'all are saying, well, Dr. McNeill's not wearing a mask. Well, Dr. McNeill's got his mask right here, but he's not wearing a mask because there's nobody you're the closest person to me. So, and that's at least 6 feet. So social distancing if you're not wearing a mask, okay? So, here's one that was asked, and I'll just get this out of here. Can you get CO2 poisoning from wearing a facial covering? No. Okay. Should kids wear facial coverings? Absolutely. Why not? I mean, my children, I went to Amazon, we bought some little kitty masks. They actually think they're kind of cool. Okay. They wear them around the house, so which I guess is all right. So one last thing, rumor control as far as flu shots will make you test positive for COVID. No. Okay, that doesn't happen. They're two different viruses. I even read a thing the other day that said, that these positive cases are because they are preloading the swabs with COVID so that they'll come out positive. Okay, well, that doesn't happen either, all right? Hospitals, as far as the cleaning and everything that's being taken care of, our hospitals, of course, I mean, really and truly, if you want to see people that are safe about COVID, go to the hospitals. I mean, that's where we're very particular about that. Okay. Anyway, those are the things I want to say. I'll finish up and let David tell you some of the statistics and some of the other stuff that he wants to get out here. But just remember, folks, that this disease is all over the place. I mean, if you go out, if you're unmasked and you're not socially distanced and you're around a bunch of people, you need to think about the fact that you probably, or not probably, but you very potentially could get this disease. There could be one person in this room right now, and it may spread to 2 or 3 people. It may spread to everybody in the room. We don't know exactly why some people get it and some people don't. But we do know that it's spread by droplet therapy. They're kind of downplaying the fact that maybe you can spread it from touching things. But still, viruses can be spread through your hands. So use the hand sanitizer, socially distance, and wear a mask. We're not going to make it. They're not making it mandatory. That's what they're talking about, and I back that right now. But I'm telling you that if it gets worse, a lot of cities have made it mandatory, and it may end up that way. We don't know. I really thought it was going to increase, but I didn't think we'd get 89 or 90 cases in 3 days. So, but a month from now we may be saying, "Wow, I remember when it was only 90." So let's be careful out there. All right.
I hope you're wrong about that, by the way.
I hope I am too, yeah. I was hoping I was wrong about this one, so.
Thanks, Dr. McNeill. Like Doc said, it's covering a lot of good topics there. Like you mentioned, we had 38 cases yesterday. We have 150 active today. The good news is we had 189 recovered, but as that active number gets closer to that recovered total, that's definitely a concern. So our total as of yesterday, we're sitting at 347. We do not have numbers in today as of yet. I know there were some folks that were a little upset yesterday when the numbers didn't come out at 5 or 5:30. We're getting the numbers out as quickly as we can. We're over inundated with cases right now. We've increased our epidemiological team, the numbers on the team to be able to handle investigations. We ask for patience is all we ask for. They are working 7 days a week, 12 to 14 hours a day, so they're doing everything they can to get those investigations done. So keep in mind, if you are a positive case, if you get notified from a lab or from a doc that you're a positive case, there may be a little time. You may not get a call right away. You may not get a call, the very next morning if you tested positive at 8 o'clock that night. Just give us a time. We're going to get to you as soon as we can. There's some questions that we had on social media yesterday. There's some confusion about some reporting numbers. I think another county next to us in Jackson County had reported a different number than we gave. We're guessing they were given the DSHS numbers from the state board, but keep in mind the numbers that we report out on a daily basis through our social media account and that the local media pushes out are the accurate numbers coming from us, and those are up to the date numbers. The counties around us, none of them have epidemiological teams and epidemiologists that will handle the cases and the case positives when they come in. So a lot of their cases, or all their cases, are going to go through DSHS Region 8, which may take a day or two for the state to report back on those numbers. So the numbers we're giving out here on our Facebook and our local media are going to be the most accurate, up-to-date numbers there. There were some questions regarding some classification of cases. You may have heard the term probable case or pending case. For clarification, a pending case is a case that's still pending investigation by our EPI team. It's a case at that point that we believe is a positive. There's a case investigation. We have to determine county residents, and then we got to determine that is truly a positive case. And then a probable case is one of those cases that have had a high-risk exposure, such as a family member, and significant evidence of a COVID infection. So a lot of times, some of those folks don't want to get tested, and we can't force them to get tested, but we do treat them as a positive. So if you're in a resident of the house with another positive case, a spouse, for example, and you're displaying symptoms such as that are related to COVID, chances are you are a case, and we're going to treat you as such and recommend you do the same precautions as a confirmed positive. Going off that, some advice for those who've tested positive or be in a household with those folks, or even in a business you work with one, a positive case. Just want to make sure it's important to clean those areas, do an intense cleaning of those areas if it's in a business where those folks may work around their desk and the area that they frequent most. And then if you live in a home, one, you're going to be considered a high-risk contact for sure, and you'll be notified by our contact tracers and give you advice on what you can do to take precautions from then. They will reach out to you. Again, I just ask for patience in that. We've brought in some additional staff in the past few days to handle this caseload, and they're still trying to catch up as much as we can. I know as of yesterday we had about 20 pending cases that we hadn't got to yet. So I think we're really catching up today, and that we brought in additional staff. If you look at some numbers across the region, across the state, they're much higher than that. So it's statewide, it's an issue, but I can guarantee we're working as hard as we can to get that situated and get that resolved. One thing that the Office of Emergency Management here did, working with the State Department of Emergency Management as well, was able to bring in a walk-up mobile testing site. That will be Thursday and Friday. I think the judge mentioned that earlier. It's going to be Thursday 8 to 4 and then Friday 8 to 12. There's no charge, and it's just a walk-up. You do not have to have a doctor's script in order to get testing done there. So that's a great opportunity for folks that may be able to afford a test or have access to a physician, that they can go to the community center and get that test done. Want to give you just some, Doc touched on some local hospital bed counts and ICU availability. Looked at the latest updated regional bed counts and ICU availability in the region here, which is Victoria and the contiguous counties, so Lavaca, Calhoun, DeWitt, Jackson, and Victoria. There's 203 available beds right now. We have 25 available ICU beds in the region, and then 52 available vents in the region. That's as of yesterday's count issued by DSHS. And right now, the last update we had as of yesterday, we had 11 Victoria County residents in local hospitals. So Doc gave you the number of total hospital count of COVID cases. This is the Victoria County residents. So as the health department, those are the numbers we look at, and then Doc gave you the perspective from the hospitals here. One thing we really ask folks to keep in mind is, right now we're seeing a lot of the younger people get this illness and reporting as positives. Those 20s, 30s, and 40s. We're seeing a large number of the cases that are in those age groups. Keep in mind, though, some of these young people may not be suffering severely from the illness, but that's not to say it's not serious. I mean, you've got to understand that, you may be not suffering yourself, but again, like Doc touched on, you could be going to visit a family and friends that are more susceptible to illness, maybe immunocompromised or older at higher risk. So you want to keep in mind that you may be suffering, but you can cause suffering in others by transmitting that disease. Just in closing, we talked about a few months ago that, when we stopped the press conferences initially, we would be back to provide updates if things got worse, and they did, and that's why we're here. At that time, we had low case counts, and that was great, but keep in mind what we're doing at that time. At that time, we were social distancing, where most of us were wearing facial coverings in public, and that's what we're asking you to do today. We're asking you to do the same thing we'd done back then, months ago, when we had those low case counts, and we're asking you to do those same things again, so we don't have to go back and look at having orders from the governor or a judge or mayor to do further restrictions. We want to prevent that. We want folks to really take responsibility on their own, and wear the mask, socially distance as much as possible, so we can keep this positive momentum going. In closing, that's all I had. I'll just open it for questions at this time.
Dr. Dr. McNeill, David, I was just wondering, masks have been the kind of one of a handful of primary tools you and other public health experts have recommended for weeks, if not months. I mean, why do we think that those habits are going to change, or what would you tell people who won't change their habits with regard to mask wearing?
Simply, I'll do my part. David just explained that. If you look at it, before we were wearing masks, we were social distancing. Numbers are low. Less masks, less social distancing. Numbers are high. There it is. So, I'm just saying that this virus needs a reservoir to live in. And right now it's a new virus. So no one has immunity to it. So it goes where it wants to go. And that makes it very contagious. So it's got a lot of places to go. We just can't let it get there. And the way we stop it from getting there is social distancing and masks.
I think really people let their guards down. We were in a good spot. We had very few cases. I think we went almost a whole week with maybe like 2 cases. So it was great. It was a good thing for us. I think the public got relaxed. I think we all did. We were optimistic that this may have been, going away. So folks started, it's like, all right, well, let's open it up. Let's get out. Let's do things. Let's socialize. And unfortunately, that's when the virus came back. So obviously that's one thing. Really, like Doc said time and time again, that's all we have right now. There's no vaccine. There's no preventative. We have social distancing and we have facial coverings, and that's about it. So that's why we keep saying the same thing over and over again, the press conferences, because that is all we have right now.
And my big concern is that this is June, okay? June is typically not respiratory transmission or disease transmission time. What's going to happen in October and November? Yes.
I do have a couple of questions, so I want to just ask them one at a time in case, because I know you might have a couple of questions too. My first question is about this testing that's going to occur on Thursday and Friday. Who are you looking for to come and get tested? Are you looking for people who are curious? Are you looking for people who might be showing symptoms? What's the behind the scenes? What are you guys, thinking that this type of, free testing that you don't have to make an appointment for? What will that accomplish? And is it going to be, safe?
Yeah, so a lot of questions there. So really what we're looking for is, the state offered this service up to across the state. They wanted to provide, and I agree, it was a great opportunity to provide free testing for those individuals that either can't afford a test, may not know where to go, may not have a medical provider that can prescribe them something. There was a goal to provide free testing for those folks that may be missed. Unfortunately, when you do a set testing like this, it's a moment in time. So Thursday or Friday, if you're symptomatic, if you're shedding virus, you'll get tested positive. Hopefully we can really catch any of those that, again, haven't had the opportunity to really go to get a test done.
You're really looking for people that are showing symptoms. You're not looking for people who are curious if they've had it or if they're...
Correct, because it's not going to be an antibody test. It's going to be a viral test. Doc, you want to...
Or even patients that may have had an exposure that they consider. If they think they were around someone that had COVID, that might be a good reason too. One of the things that in public health we try and treat everyone, and of course there are patients that don't have opportunities to get to a physician or get an order or can't afford to go to a walk-in clinic and pay for it. So that's one of the reasons that they're here too, and that's we applaud that.
Thank you.
Regarding the citizens outbreak, do we know what day the first case was identified, and do we have an estimate for about how many folks might have been A, tested subsequently, and B, contacted?
I don't have the
as far as that,
number.
I think I got the first call on Saturday. I think it was.
Okay.
Don't quote me on that one. But for the most part, I can tell you that I know that they did over 100 tests yesterday, but these were also some tests. And Dr. Kano, the chief medical officer there, told me that these patients were tested. Of course, the patients that had any exposure to anyone that had COVID were tested. All the employees and in other words, if one person went to another department, then that entire department was tested. So they were very extensive and very thorough. And I'll tell you something else they're doing is that they tested all these patients, but within a week they're all going to be retested again, just to make sure that we did not miss that window of a time that a person was infected but wasn't able to be tested. Remember or be able to be tested properly, in other words, to show positive for the disease. Because you can say if you were to be exposed to the virus and the virus gets into your body and starts replicating on Monday, it may take 24 to 48 hours before there's enough virus in there to test positive. So we're very careful about that. So all these patients were tested, and like David just said, we say that it's at one moment in time, but they're going to confirm that by repeating that testing within a week.
And one thing I do want to touch on the outbreaks, we may have got the first notification on Saturday. We may have got one of the positives on a Friday. But in order to really link those, it takes a couple of days worth of investigations by the EPI team to say, okay, there's some commonalities behind these cases, and that's what kind of leads to an outbreak determination at that time. We can link those cases together and say, okay, this came maybe from a similar place, and we can link those back to and classify it as an outbreak.
David, you were talking about how the virus is reaching younger people. Is there a way you can talk about demographically how that's working, like how it's going on demographically wise?
Yeah, good question. As far as are you asking specifically about the age numbers and things in general, or just kind of the habits more so?
Both.
Yeah, traditionally we're seeing, I don't have the exact ones in front of me, but the ones the past week or so have been, rough, a lot of 20s, 30s is what we're seeing right now. Early on, we're seeing really across the board, and they kind of tended to, I think they may have been a little bit older in the 40s and 50s in general. I don't have this week's numbers in front of me. We can definitely get that together and see and really look at this. But, we're seeing a lot of commonalities in the places they've been and the activities they've partaken in, and that typically is of the younger crowd. So there may be social activities, bars, gatherings, parties. Some of the habits of that younger, 20s and 30s is what we're seeing, and that really is, some of the cause of the spread.
Yeah, and I can tell you this, that when I looked at those hospitalization numbers, one of the things that they said that 25% of those hospitalized were between age 20 and 29. So this is not just elderly people, and a lot of young people think that they're impervious to this. Excuse me, but I'm telling you that you can be young and get sick too. So.
Is the younger demographic, are they showing less symptoms? Because I'm wondering, one of the things that I think is so intimidating about all of this as we've gone for the last couple of months is that I really feel like it's the asymptomatic that really, worries me the most, which is why it's so important to, as we said, social distancing and wearing masks. Right. Are the younger demographic showing less outright symptoms? I mean, is there a possibility that they just don't know that they're sick?
Go ahead, yeah, and I think we'll both have something to say on this. Absolutely, and we don't like using the term asymptomatic because, waking up and feeling a little more tired is technically a symptom. So, one day they just may feel a little more worn out, like Doc said, maybe a little tickle in their throat, or maybe they can't smell as good as they did before. I mean, those are really symptoms. So it is those very minimal and minor symptoms is what we're seeing. And folks go on, and it's just like, well, didn't get enough sleep last night, and they assume that's what it is. So we don't fault them for it. I mean, it's they really do not know.
Yeah.
We're just not being cognitively aware that perhaps that is in itself a symptom.
Yeah.
Well, we know that the symptoms are milder in younger people, so it just makes sense that they would be able to transmit it without overtly knowing it.
And the last question that I have, but I don't want it to take away from anything that we've been talking about as far as social distancing and wearing masks. But what is, as these cases are increasing, are the ICU numbers increasing and the death count, is that also increasing? Is that in the same ratio as the higher counts now that we're seeing? How do you guys feel about that?
Go ahead. No,
well, the thing that worries me is that, like I said earlier, that typically the people that get in trouble with this disease is after a week or so after they've been sick. The majority, there's a progression that we see, and we really haven't had time for that progression because the 38 that we diagnosed yesterday, in a week from now we'll know if they're going to be hospitalized. So as far as, and really I think I read somewhere that most patients that succumb to the disease or die at like day 28. So to say that these numbers are high now, but they aren't dying, so it's not a big deal. Now, I know you're not saying that, but what I'm saying is that there are people that do believe that, and we just don't have that data yet. So,
sorry, real quick, just add one more thing. My fear really, and the one thing I'm worried about is, kind of the second generation of this virus that we have really the past week is, who are all these 20s and 30-year-olds going to go home to? Do they spend Father's Day with their older, parents and family members? And, hopefully in another week or two, we don't see an increase in those age groups. And that's what we really want to keep from happening. And that's why we really want those folks to be cognizant of who they're around.
That's a very good point.
Just one more quick question on the outbreak. I mean, Dr. McNeill, you kind of addressed this, but just to go back, for folks who had an appointment at Citizens in the last 10 days or folks who have an upcoming appointment and are concerned, I mean, what would you say to them?
Well, I would say, like anything else, watch yourself for any symptoms. But I can tell you that all the patients, according, I spoke with Dr. Cano right before we went on there, was that all the patients that had a significant exposure. In other words, if there was a provider or say a respiratory therapist or whatever, a technician that had an interaction with that patient, those people have been contacted and are being tested, or if they haven't already been tested. By the end of today, everyone will have been tested.
And keep in mind, those positives are all isolated at home right now.
Okay. And then just wanted to circle back. I mean, is this the first time we've been at widespread transmission since the pandemic started, and about when do you think we hit that point?
I think the numbers, we were talking all weekend, I mean, multiple times over the weekend, and really talking about this. And I think by the time we got I think Sunday was one of the higher counts, really, terminated essentially probably Sunday mid-afternoon.
We talked all weekend, but nobody really wanted to say the word. So, I mean, the W word, whatever that is.
Yeah, because that's one thing we try to avoid the whole time. This is where we didn't want to be and where we're at it now.
Another W word is for second wave. Is that a useful way of thinking about it? Is this just a bump in the first wave? Is it a second wave, or not even helpful to think that way?
I think it's really the same wave that was just enabled a little bit by lack of certain things like just being around each other. I think that it was just kind of I think a lot of people really thought, and when you looked at like Memorial Day and you looked at the things that were going on, and of course we all saw the pictures of the big parties and on the beach and all the people that were getting together, and I understand. I mean, people have been penned up for months, and I just think that it just probably was a little premature.
Good. Any more questions?
Last one's pretty quick. I mean, do you think, have we had any truly asymptomatic, literally no symptoms?
I couldn't be able to. Yeah, I don't have the details of all the cases. The EPI team may be able to comment more on that, but usually there's always something. There's always a little. Yeah. It's just not very evident, and it's some things that we may think is just allergies. Woke up with a headache today. I have headaches once a month or whatever. It's
not uncommon after we diagnose someone and they initially said, "No, I haven't had any symptoms," and they say, "Well, your COVID test came back positive," and they said, a couple of days ago, I did kind of have a scratchy throat.
Yeah, and they just didn't realize it.
Yeah, we do see a lot of that. So, but you know what? If it's mild like that, but the problem is that those people are still out and about. So if they'd have been wearing a mask, or the other people around them have been wearing masks, and we'd had some social distancing, then we probably wouldn't be reporting. I know we wouldn't be reporting as many numbers as we are today.
Good. One last question. Yeah, go ahead.
So, do you guys think that we should all be wearing masks? I mean, honestly and truly.
If you're in a public setting, in a social setting, absolutely, yeah,
absolutely,
and you can't, distance yourself and around other people.
And it's really not, and David and I've talked about this a lot. It's really not a political issue. Yeah. I mean, it's a health issue, and it has to do with health. And I'm telling you that this is spread from your mouth to other people's nasopharynx. Okay, so if you can block that, then that's probably a good thing. And it typically doesn't go greater than 6 feet as long as people are not screaming and laughing. I mean, we know this evidence. I mean, some of the biggest outbreaks we've heard of are like at a church where everybody's singing, okay, because you're raising your voice. They even did a study that they looked at the droplets. Somehow they were able to measure how far these droplets went. And they had a normal tone of voice, a screaming voice, and singing and stuff like this. And they found that the louder the voice and the more, but big activities, people are outside screaming and laughing and having a good time. Maybe there's a little alcohol involved, and there you go.
Exactly. Thank you, Dr. Meal. I want to thank everybody for your time and for tuning in. Just keep in mind to get accurate information. If it's released on the Victoria County Public Health Department Facebook page, it is the accurate information, as well as victoriatxoem.org. You can go on Facebook, like I said, to the Victoria County Public Health Department for the latest updates. You can also call the health department if you have any questions regarding COVID-19, and as far as public health related questions, or if you have any questions about governor's orders, you can go to open.texas.gov. Keep in mind our testing site will be available on Thursday and Friday at the Victoria Community Center from 8 to 4 on Thursday and then 8 to 12 on Friday. You can tune in to Sudden Link Channel 15 or 115 for this replay of tonight's press conference following the City Council special meeting this evening. I want to thank you all for your time and collaboration in helping slow the spread of COVID-19 in Victoria County. Thank you.
Thank you very much.